Yeah. Morning, everybody.
Good morning.
I'm Robert Ferris-Rogers. I'm Director of Engagement and Service Redesign at Newark and CCG. See yourself.
So I'm Helen Shrives. I'm an acute contract manager, so I work for Mansfield, Nashfield and Newark and Sherwood CCGs.
So I'll tell you a little bit about what the Clinical Commissioning Group does, and then I think what's of most interest to you is the Dementia Information Service. Newark and Sherwood Clinical Commissioning Group is the NHS organisation that's responsible for planning and buying the services on behalf of its local population. So just to put it into context, across Newark and Sherwood we spend over £400,000 on healthcare every single day of the week. So that's the sort of amount of money that we spend for the 130,000 population. And we're responsible for the whole raft of services, from your local GP practices, so the practices in Newark, we commission those services, through to Newark Hospital, acute contracts like Kingsmill, Lincoln, Nottingham, and also we for community services like district nurses and district nurses, and we also commission mental health services. Part of the commissioning process is about us assessing care needs, putting in services, and then evaluating the effectiveness of those services, as in, are they doing what our local people and population needs us to do. And I think in terms of the dementia information service, people often get a little bit sort of scared when they kind of identify that we're doing what's called a service review at that point in time. So we're looking at the services that we've put money in for, are they being as effective as we possibly can do, and actually could we improve that and make them even better in the future. And that's what we've been doing recently around the Dementia Information Service, which was set up around about 2 years ago, and we've been doing a process of review. Now that process of review has been about understanding from people who use the service what it's doing, understanding from our local healthcare professionals, understanding from other services that deliver support to dementia sufferers and their carers, as to how effective those services are. And part of what we also had was a number of inputs from your group in terms of actually the value that you clearly show and demonstrate around that service. So we're getting to the end of that evaluation process, and I think what I would like to do is to reassure you that we are not planning on taking any resources out of dementia services associated with the Dementia Information Centre. So the review that we've completed, which is, this and another event which we're going to next week are kind of the final bits of it, is demonstrating absolutely the value that Amy and that service is delivering. So we are not planning on taking that resource out of it.
Good.
Okay? Now what we have identified as part of the review is two things. One, that actually when we spoke with local GPs and other healthcare professionals, they didn't know consistently about the services that Amy provides. The other thing that came through clearly was that we could be better at connecting the work that Amy does with the Alzheimer's workers, the Carers Hub, and other services like the Compass workers in Newark. The other thing that Jane and I have agreed that we're going to be doing is putting in a health hub in Newark Library, which will also bring all of this kind of support information around dementia together in one place in an area that's accessible. Jane?
We find the same thing regarding the doctors and that, not knowing about this group.
Yeah.
It's the only local group that's providing activities for dementia, and as you can see with what we've got here today, it's a viable family group.
Absolutely.
We support each other, and I feel that we should be more well known in these services.
So they GPs have a protected learning time once a month, have done the dementia friends training, and actually the feedback from that was quite fabulous, because I think they kind of think sometimes because they medically know everything, they kind of know a lot about it, but actually that dementia friends stuff created a lot of insight, so there's been different conversations. One of our practices, which is Fountain, at looking at how can they make their surgery dementia friendly, which I think is a fabulous idea.
Yeah.
How many other people are with Barnbrigade surgery? We have a great deal of trouble making an appointment. We have to ring on a Tuesday morning, which we can't because we can't get through. When we do eventually get through, all the appointments with the doctors that know us, that know our circumstances, all the appointments have gone.
Right.
So we have a great deal of difficulty making an appointment to see a doctor of our choice.
I suppose the challenges we have locally are no different to the challenges we have across England in terms of access to general practice and the availability of doctors in particular. So, you know, Barnbrigade has vacancies that they are covering, as do most of the practices in Newark. I'll talk with Sally at Barnbrigade and I'll pick up the issues that you raise, as I will ensure that another of my colleagues, Sue, picks those up with all practices across Newark and Sherwood, because it's really important that we get appointment systems that work for you.
From my own experience, and I don't know whether it should be over and across the board, but when my wife was diagnosed with this problem, they put some kind of an asterisk or some signal to denote that I was the carer,
Yes, it's on
so that whenever I wanted to get through for some information, you got kind of a little bit of priority.
Yeah.
Because of this thing now. Everybody that's down at the Barnbrigade surgery, if the carers had got that on their medical notes, or the person who's got the problem, knowing who the carer was, you might get a little bit more joy, if you like to call it that, by getting through. But I know that that's what they said to me. If you're a carer, right, well, we'll make this note on your documents.
Yeah, they do it on the documents, but
Yeah.
is it on that computer when you ring to
Well, I
make an
don't
appointment?
know.
It will be, because
I've
it's
got
a marker that's part of the GP record. All of our practices across Newark and Sherwood use the same system.
Yeah.
So the marker is connecting you as a patient in terms of it to a carer, and you don't need to be registered with the same GP practice to be identified as the carer for that individual. So I know you've got one registered with Lombard Street and one registered with Barnbrigade, with the carers registered with Lombard Street and the patients registered with Barnbrigade. They can still connect the two together in terms of identifying people.
People that suffer with Alzheimer's and dementia are old. There is too much information. There's leaflets coming out of areas.
Nobody reads them.
Do you think that people can read leaflets and understand them?
No.
You know, when they've got all this stress that they're dealing with. What we need is a simplified document. What is available free
Okay?
to carers and their partners.
Yeah.
I found that I was desperate for help, and thankfully Amy was the only one that helped me.
I think you make a really strong point there.
Absolutely strong.
And just as we're trying to get simple information for GPs, I think actually the reverse side of that is how do we package that same information for a public face? So I think that's perfectly doable. So I'll take that back. And
my husband was diagnosed with Alzheimer's 6 years ago at the age of 60. And we were referred to the working age dementia team at that time at Byron House. And we had a wonderful CPM that came round and used to visit us. And we were told if there was an area to get dementia, Newark was the best area in the country because of the support that was around. Well, 6 years down the road, I mean, it's a day service today, that's why it's not with me. But we get there's nothing from Byron House. I mean, as far as I'm concerned, it doesn't exist. We get no support from them. CPNs, I don't know whether they're still around. What, should we have a CPN and what should we
Precisely,
with Byron House?
okay. It's not an area of my speciality in terms of actually understanding the detail of that. So I think my answer is I don't know what the procedures are, because that's dealt with, sorry, I might sound like I'm bouncing it, it's dealt with by a colleague of mine called Karen Glynn, who commissions, buys mental health services.
The local GPs not being aware of certain things. I'd just like to say good luck with the education of the local GPs, because I know for a fact that for the last few years they've not even been aware of the services that Newark Hospital provide. They are referring patients to other hospitals which could be referred to a Newark local hospital, but they're not doing that because they're not aware that Newark Hospital actually provide that service. And that's probably one of the reasons.
Can I pick that point up in particular?
Yeah.
Because I feel very passionate about this. So local GPs, when they're doing a referral, refer you for treatment.
Yeah.
They do not refer you to a specific hospital.
No.
Okay?
Yeah.
When they get referred for treatment, you will go through in Newark and Sherwood something called a gateway.
Yeah.
And the gateway is there to help you make the choice of provider. Care is incredibly complex nowadays, and the gateway can only provide you with the choices that are available on the national choose and book system. So those are clinics that Newark, Sherwood Hospitals, or Lincoln, or whatever provider has made available there for your condition that you've been referred to. So the bit that you said that they're not aware of the clinics, actually the GPs have a very broad range of I suppose, areas.
Yeah, but they're still not aware of all the services that you're
No, they're not. Just the same as you're probably not aware of every single name in the phone book, and that's how complex care has become nowadays.
No, I don't agree with that. It's not as complex as that. A local GP should be aware of all the services that their local hospital provide. Now, if they're saying to patients, oh, you can't go to Newark Hospital for that because they don't provide that service, and they actually do.
But it's the gateway can only offer if that service is on the national choose and book system for an appointment to be made. So what I'm saying is it's about the Newark Hospital ensuring that its full range of services are on what's called a directory of service, so that actually people can book into it. It's not the GP's fault.
My other point was, surely Barnegate surgery are failing if they're not looking at all their age 75 and over patients and not designating them a particular doctor to look after them, which they should be nationally.
I did have a letter telling me but I still can't get an appointment with that particular doctor. I did get a letter saying that.
So you have been allocated a particular doctor?
Yeah. I changed my doctor to somebody else.
Right.
Because I can't get it.
Yeah.
And I can't tell it because the doctor in particular knows all that.
I will pick that bit up.
You have
I mean,
time
we
to
all.
tell a new doctor everything that's wrong.
we all kind of have a named doctor, because the way that our system is based in the United Kingdom is that we register with a GP, we don't register with a practice. Okay.
I'd just like to answer I had moved here 2 years ago and I was designated a doctor. I went to see him and he said, I'll see you in a month. He'd left. I've had 5 different doctors.
Which practice are you at?
And I'm at
Bolton.
Bolton.
They have had a significant turnover of GP practices, but GPs working at Bolton. They've now got a reasonably stable team, and actually, I think they've got a real sort of grip now on what they're doing as a practice. But they've got 3 GPs that are kind of settled, and they're the same GPs that you kind of see all the time.
Can I just say that the service from Amy has been invaluable. And anyone here that needs help, please ring her because she will help you. She's such a nice young lady. She will help you as much as possible. And I will put her number on the next minute so that anyone that needs any help at any time, please ring her and she will sort it out for you, hopefully.
Okay. Dan.
We're having a problem at the moment with the Alzheimer's Society.
Right.
According to them, when your partner passes on, you no longer exist. And this is when we need a lot of help.
Okay.
And there's just nothing there.
Right.
This is the only group.
Okay.
You still have your problems even though you haven't got your partner. You've had years of doing things a certain way. You know, you need to change your whole way of life and nobody's helping.
Okay. I'll take that back. I see the Alzheimer's local contacts quite regularly.
Earlier regarding the Alzheimer's Society. They apparently had a directive issue to them last week, appertaining to the fact that when a carer is on the road and the person who's been looking after them to go in a home, that they're no longer welcome to go to the dementia cafe.
Right.
In one breath, the directive says that family and friends
Oh well.
are welcome, and the friends, as far as I know, wouldn't know half of what these people know about looking after anybody anyway. And in the next breath, because your partner's not with you anymore, that you're not entitled to go to the carers cafe.
So the Compass workers have been being done as a pilot. They're a little bit like Admiral nurses, but what they went down the route in Nottinghamshire was what's called Compass workers. So it's a bit like the Admiral nurses, but more about the sort of directions, so etc. So in terms of the pilot, what we wanted to look at was those people that had specialist needs, to look at whether or not there was real benefit in having a different type of worker working in the community mental health teams supporting people that way. So the evaluation is being completed at this point in time. The early findings that I've seen around it have been that people have really benefited from having the Compass workers, and then we need to consider the outcomes of that as to what we do further forward. And I think that comes back right to where I started, which is we need to kind of join all these bits up together, because at the moment we've kind of got little bits all over the place, and actually we need to have something which is much more comprehensive, and therefore the review from the Compass workers will feed into how do we have a better, more connected service for people either living with or caring for people with dementia.
Is PRISM still in existence?
PRISM is still in existence, and again, this is part of
They were wonderful.
this is part of the element which I want to show with the Compass workers.
Yeah.
Is the Compass workers are in the specialist bit of the service, and PRISM, which is very much about providing care in
Yeah.
people's own home, but from a much more generalist perspective, they need to connect together. So we need to join those bits together. So
Found them very helpful.
I'm really pleased because it has revolutionised a lot of people's lives.
Very
I'd like to thank Robert and Helen for what they've done and told us this morning, and I hope that it's borne fruit for everybody. Thank you very much indeed.
Thank you.